The cardiological and hematopoietic diseases of swine. For the cardiological diseases of swine, they can be congenital or acquired. The congenital diseases are tricuspid dysplasia, persistent common atrioventricular channel, and an atrial septal defect. And the acquired diseases are bacterial endocarditis, myocardium diseases, pericardium diseases, and vascular diseases. The heartbeat is on the left side between intercostal space 3 and 5. Cardiac dullness is in between intercostal space 2 and 3 in thin and young animals. The pulse, we can feel it on the facial and femoral arteries. This is difficult because the animals are so fat, and the mandibular artery is used for anesthesia. Bacterial endocarditis is caused by erysipelathrix ruseopathy, Streptococcus, Staphylococcus, and E. coli, as well as Corynebacterium pyogenes. Bacteremia can lead to hematogenous spreading. The clinical signs are fever, apathy, anorexia, and chronic weight loss, as well as cyanosis, tachycardia, dyspnea, and coughing. For the diagnosis, we can hear a grade 3 to 4 out of 6 holosystolic murmur above the mitral valve at intercostal space 5. And we also need to do a hemoculture. For the treatment, give antibiotics, as well as heart failure treatment. The myocardial diseases can be viral, bacterial, or nutritional, as well as toxicosis or congenital. The viral diseases can be foot and mouth disease, fine vesicular disease, parvovirus, and PRRS virus, as well as encephalomyocarditis. Bacterial diseases are Staphylococcus, Streptococcus, and Salmonella. The nutritional diseases are vitamin E and selenium deficiency, which causes mulberry heart disease. It occurs in young, rapidly growing pigs, and it often leads to sudden death. Oxidative stress and free radicals can cause heart deficiency. In post-mortem lesions, we can see an enlarged pale heart with diffuse bleeding and fibrin and fluid. And the treatment is you give selenium and vitamin E in the feed or as an injection. In the case of congenital diseases, they can get stress. In the case of porcine stress syndrome, and they get malignant hypothermia. For the pericardium diseases, they can get hemopericardium, hydropericardium, and pericarditis. Pericarditis can be caused by actinobacillus, Glasserella haemophilus parasuis, also known as Glasser disease, and Mycoplasma and Streptococcus suis. The fluids can be transudate, modified transudate, and exudate. In transudate, the cells are less than 1,500 cells per microliter, and the fluid is colorless and clear. In a modified transudate, the cells can be 1,000 to 700 cells per microliter. And in an exudate, it's over 5,000 to 7,000 cells per microliter, and the fluid is yellow and cloudy. In Glasser's disease, caused by Glasserella parasuis, it occurs when the animals are 4 to 8 weeks old, and the signs are fever, central nervous system signs, and cyanosis. In pathology, we can see fibrous exudate in the cavities, and vasculitis and septicemia, and you treat with antibiotics. Vascular diseases can be bacterial or viral. The bacterial diseases are actinobacillus, E. coli, Glasserella parasuis, and leptospirosis, and Streptococcus and Salmonella. And the viral diseases are African swine fever, classical swine fever, and ovine herpes virus 2, also known as malignant catral fever, and porcine circovirus 2. Hematopoietic diseases of pigs. This includes blood-losing anemia, hemolytic anemia, nutritional anemia, and iron deficiency in piglets, and methemoglobinemia. Blood-losing anemias can be caused by bleeding gastric ulcers, strongyles, acidocards, and hyostrongylus. You treat with albendazole, as well as Trichuris suis, and you treat with fenbendazole. Hemolytic anemia, it can be caused by erythrolysis in newborn piglets. This is when the maternal antibodies act against the piglet's blood group. Or when there is a sow or boar incompatibility in the case of Mangalitsa and other breeds. In the case of Mycoplasma haemosuis, it can be from insects or needles or transplacental infections, as well as leptospiro, and it's treated with doxycycline. Or cytomegalovirus. Nutritional anemias can be caused by iron, copper, and cobalt deficiency, as well as vitamin B12 and essential amino acid deficiency. Iron deficiency anemia in piglets occurs in fast-developing piglets in intensive husbandry. It occurs when there's low iron in the sow's milk, or low iron reserve in the mother. This is because in intensive husbandry, there's a limited iron source. Severe anemia occurs at days 6 to 14. They're known as porcelain piglets. They have tachynoa, weakness, and they can be squashed to death. You also get microcytic homochromic anemia. Mild anemia occurs at 1 to 4 weeks. They have retarded growth, which is poor for fattening efficiency, and they're prone to secondary infections due to decreased immunity. Lab results, we can see decreased hemoglobin, decreased packed cell volume, increased reticulocyte count, and decreased iron, but increased iron binding capacity. Treatment to give iron, you can give it orally or intramuscularly. If you give it orally, it can be 12 hours after birth, in the case of iron dextrane. And if you give it intramuscularly, it's 2 to 5 days after birth. Iron dextrane intramuscularly. Methemoglobinemia occurs when there's ammonia in the food and water. This decreases the hydrochloric acid in the stomach. Causes iron 2 plus turn into iron 3 plus. The signs are sudden onset and cyanosis. Diagnosis, you can see an increased coagulation time and chocolate brown blood. And for the treatment, give vitamin A, vitamin C, and you can give orally, and then you can also give methylene blue.